Welcome to the HBOT News Network. I'm Ed DiGirolamo, and I'm delighted to have a conversation today with a very special guest that's come in from Montreal, Tom Fox, and Elena Schertz, who is the clinic manager. Tom is actually the safety director for the clinic Extivita that Elena manages. And today we're going to work on something or discuss something that I think is very important. You hear about case studies which come out, essentially it's individuals that have gone through a certain protocol and what's the result of that as an individual. So it's not like this peer-reviewed, very detailed group of people going through a certain protocol. But case studies are very important because you actually get to be with the patients, see the outcomes, and then you can see that repeated with other patients. So without further ado, I'd like to introduce Tom. And Tom, perhaps you can give us a little background on your experience. And as I understand it, and I've known Tom now for nearly 10 years in the HBOT world, and I've always viewed you as the international historian for hyperbaric oxygen. So I'll let you take it from there.
That's what happens when you've been around for as long as I have. I've been doing hyperbarics. I've been in the hyperbaric field for 31 years. I entered as a medevac pilot, and I was selected to go to training and through San Antonio, and I became a member of the faculty at the School of Aviation Medicine, so that was my entry. There I served as the chief of the atmospheric surveillance, which meant I had the altitude chamber training, and I also had hyperbarics under me. We were very involved in a lot of the things. Some of the patients that we were involved with were some of the first casualties of the first Persian Gulf War. One thing was notable that is when they came to us, they had no further loss of tissue, and these guys had been affected and been wounded by landmines. So that was a very telling thing, and that was probably some of the first casualties I ever treated. Since then, it's been a long way, and we've treated a lot more than that.
Well, I understand, because you had brought this up earlier that Claudine, your wife, and you're in it together in this hyperbaric oxygen adventure as of late, and she counted actually that you've treated up to 42,000 individuals.
That is correct. We keep count as everybody goes through, and we do a lot of follow-up, and it's amazing to be a part of everybody's story. I've seen incredible things. I've seen children talk and speak to their mother for the first time. That's special. That's special, and a lot of the things we do, you see them every day. Lately, we're treating a lot of people with long COVID, and we're seeing them reestablish their lives after they've been affected by this, and that's really something.
Mm-hmm. That's incredible. I've gotten hugs from the veteran family members that have seen their loved one come back after having suffered from PTSD for a long period of time, and I can understand that feeling is nothing can replace that. And for those of you that are new to the HBOT News Network, perhaps you don't know about Elena's background, but Elena does manage Extivita. It's in the Research Triangle Park in North Carolina, and has a lot of patient experience, as well as Tom. They both have it. So we're just going to allow them to bring up topics. And Elena's a nurse practitioner, and she's just an amazing manager over there at Extivita, which is very near and dear to my heart, being involved with Extivita. So those that are not familiar with your background, perhaps you could share just a little bit with us.
And I was a nurse for about 25 years.
That was an RN, right?
As an RN, yes. I worked on oncology, pediatric oncology for the most part, and some cardiology in there. And then I started to get into integrative medicine about, I would say, 13 years ago, and then first exposed to hyperbarics about 8 years ago, and then started to work over here at Extivita about 4 years ago.
Yeah, and at this point, I know we've discussed this, somewhere north of 1,000 patients you've seen with HBOT. So
yeah, at least I'm sure it's probably more than that.
Yeah, so I'm really looking forward to you and Tom and your experience with some case studies.
Mm-hmm.
And so we've talked about a number of topics that we'd like to cover, and perhaps Tom, you can start. What specific indication or area would you like to start the conversation about?
Well, near and dear to my heart is the training or treatment of the troops. The troops themselves that are coming back are actually, well, the veterans are actually trying to commit suicide or successfully committing suicide at 22 a day. And that in my mind is a critical need. It's a position that we have taken, and that we are committed to treating the troops. And in that role, it's been successful in treating PTSD, sleep quality, satisfaction with life, depression, and that's been acknowledged in the journals. So I mean, there is an effective treatment for the troops.
Nothing else quite so effective, is there?
No, what we're looking at is in the combat environment, you're seeing extraordinary pressure changes that these guys are experiencing all the time. And many of the experiences or many of the situations where they're put into, that's not controlled, and they're being wounded. And the wounds themselves are primary blast injuries, and primary blast injuries are usually subordinated because they're not visible. So the care of everything else takes precedence. And usually, if medicine can't explain something, it's usually relegated to psychology. There's a history of that, and there's a history as far back as the First World War, where many of the injured were relegated to psychiatry. You know, if there's a physical injury, we need to take care of that first before relegating them to psychiatry.
So one of the things that I've learned about you is, we view you as sort of the HBOT historian internationally, and that you have so much information that goes back to the 17th or 16th century. And really the history of HBOT and where it's been, and some of the doctors that have been involved in it, in the 1800s, and not understanding why we're not using this more, and then we come to the early, the later Bush administration. I don't know, that was after it was in the 90s, I think.
It was in the 90s.
You were in Washington, and the proof was all there that for the powers that be overseeing our veterans. And very little movement towards providing this really life-saving, life-altering therapy. And I know in the state of North Carolina, the state legislation has stepped up to fund some of the veterans to get the PTSD treatments or hyperbaric for PTSD. And Elena, you've seen some of that. So perhaps we could just talk about a case that you've seen that I think the audience would appreciate knowing.
So I would say that we've probably completed meaning treated about at least 36 veterans for TBI since we started this program that you're mentioning, where they've had at least 40 to 60 sessions. So it's been a really wonderful thing to follow these vets from beginning to post 40 sessions, and Tom was talking about the psychological effects of it, and we were talking about PTSD, suicide ideation, anxiety, and did I miss anything there, Tom? No, those are the psychological parts of it. So
executive function too. I think you measure that.
Oh God, we measure so many things actually. So executive function, cognitive function is a main part of that too. But when you ask me, like, can we talk about one of them? I would have to say 99% are improved significantly. So I think, wow, which one am I going to talk to? There's so many to pick from. But most of them, at first, I think I'll just generalize to say cognitive function improves significantly, as well as their concussion symptoms that are still sort of residual concussive symptoms also significantly are reduced in severity and number, and depression also significantly, the severity of depressive symptoms also are reduced significantly, and so do anxiety. Tom mentioned something about sleep, and that improves quality of life, relationships improve, suicidality also pretty much diminishes. That first they have thoughts about ending their lives, and by 20 sessions, that's already shifting. It probably occurs sooner than that, but when I sit down with them formally and say, what's going on, how are you, then we see that right away at the 20 mark. But it could have happened much sooner than that. But so there are many cases I could pull out of my hat, but I just wanted to really say that all of them have improved. Yeah.
How about you, Tom?
One of the individuals that comes to mind is a General Pat Maney. General Maney was injured in an IED explosion that really just destroyed the vehicle he was in. He was severely injured. Severely, but not visibly. So you have a general that's over there as a part of the legal team negotiating contracts and everything in Afghanistan. And it's interesting because he was medevac back to Walter Reed. What's important also in General Maney's care was the presence of a family member. The family members that support these veterans just can't be looked over. They're an integral part in their healing. And General Maney's wife was instrumental in that. In fact, he'll tell you that if she did not and was not participating in his care, he couldn't manage the medicines he was being given. He couldn't do a lot of the things. He was treated by a doctor, one of the most fabulous doctors in hyperbarics. And I've been able to, in 30 years, I've been associated with a lot of doctors, but I'm talking about Dr. Eddie Zant. Dr. Zant treated General Maney, and where his limited memory was, it was just evident in everything that he did. He was a lawyer. He was on the bench in the state of Florida, and his injury was going to prevent him from re-entering. He was able to re-enter the law practice and sit as a judge. So
How many treatments do you think he had?
I know he had at least 40. It may have been more than that, but his recovery was amazing, and he has been integral in actually reforming the legislative approaches to the management of those veterans that have gone astray in the legal world. So he's set up a veterans court system. So, I mean, his recovery was amazing. And that's not atypical. That's more the typical response of these veterans to health care or to hyperbaric care.
So there's so many cases, it's difficult to pick one.
Right.
Well, I'd like to say one thing about these cases. Like, for instance, you mentioned something about, about relationships. I don't know if actually I want to mention something about relationships in terms of these veterans come in, and one of the most common thing I hear is, I'm here for my son, I'm here for my wife, I'm here for my family. So you hear that's one of the most important things to them, the relationship, to keep that intact. And because of the blast injury, that becomes really challenging for them. There's irritability involved, there's emotional issues, there's sleep problems, they're tired, there's so many symptoms that contribute to the sort of that symptom of just not having them sync together. I'm not saying that correctly, but just have problems with relational problems. So they come in with that. One of the main goals is to actually get along with my wife, to get along with my husband, to spend more time and to actually be present with my child, because I don't have the patience. I'm irritable. I don't want to be in the same room. It's too loud. So they cannot be in their life with their family, who are the most important things to them. And so what happens, that starts to change, and you can see that actually happening in the clinic. The relationships they have with us and with other patients start to change right in front of your eyes. And then when we sit together after 20 sessions, let's say, you can see that start to change, like I was saying. And at 40, they will say, I'm able to play catch with my son, and I'm able to stay in a room with my whole family during Thanksgiving and not have to go in another room because I cannot tolerate all that noise or all that stimulation. They're part of their own lives. And that's a very near and dear to me. So that's just one of the things that I've heard. I can talk about a bunch of things, but.
Well, going into the medical field, it's got to be the most rewarding thing
Yeah.
that you can see. And in one of my conversations with one of the patients at Extivita, happened to be a paramedic, and he was finishing his 40 treatments, and he said, you know, he's not screaming or beating his dog. And his wife noticed that and said that to him, and he went to the state fair with his young children for the first time, and so he couldn't, you know, he just couldn't be in crowds. He couldn't be around groups of people, and it was the first time, you know, with his children that he took them to the state fair since returning from the battlefield, and so that means everything in the world to the family. Is he's able to go to the state fair, he's able to function as a normal dad, you know, and so okay. So I think, you know, the soldiers, the PTSD, we've covered that a lot. And there's a lot of documentation about that, and you wanted to add something.
I wanted to say something, yeah, because I think it's important to me. So when we talk about how they get back into their lives, suicide is an isolative sort of condition, or I don't know what to call it, but it's
It's a driver.
isolating.
It drives it. Yeah.
Right. So, and depression, big part of suicide picture. So when they feel integrated back into their lives, they don't feel alone, they don't feel isolated, and so you can start to see the connection with how that starts to also the self-harm thoughts start to go away as well. So I just wanted to make that sort of connection there.
Yeah, there's one thing I'd like to mention too is a lot of times, you know, we've been at war for the last 20 years. The effect of blast injury on operational readiness is just something that needs to be taken into account. Suicide is an integral part of that. So what we need to do is realize that this needs to be healed. You know, this needs to be approached. Operational readiness is where we're at, and you know, where are we going to be for our next war? A lot of times, the guys that are functioning, they derive a sense of team, and that sense of team carries them through a lot. When they get out of the military and they're veterans, they lose that sense of team.
Yeah.
And now they're isolated, and that's a big part of this suicidal ideation because they're no longer part of that team. Anyhow, that's one of the things that I wanted to say.
You know, one of the things too, going back, I think, you know, this is nothing new. We say the last 20 years, but the Vietnam War veterans that committed suicide, and World War II and World War I, I mean, it goes back, I think, historically, is these head injuries are leading to depression and all of what you just brought up. I imagine that isolation and the team. And when they lose their edge as a warfighter, the government, you know, the country's invested so much in their training, they're losing their edge. This needs to be available to the active warfighter, someone that's in the field. You don't just brush yourself off after an ID, you know, rattles your cage, and then you expect it to be tough. You know, get out there, and I think that's instilled in them, so they will be tough. But this is gonna hurt. It's gonna reduce their edge, I think, and so then they become a danger to their team in the field, because now they're carrying a liability, you know, more than the asset that it once was. You know?
Exactly.